Frequent urination, especially at night, is often brushed off as a normal part of aging. But urologists warn that this assumption can be misleading and even dangerous. Nighttime bathroom trips, known as nocturia, may be a sign of underlying health issues such as an enlarged prostate, poorly controlled blood sugar, or an overactive bladder. These are not harmless inconveniences. They are signals from the body that something may be out of balance and in need of attention. According to some specialists, benign prostatic hyperplasia, BPH, is one of the most common reasons older men experience frequent urination. The prostate gland can enlarge with age and press against the urethra, disrupting normal urine flow and causing repeated urges to urinate. In other cases, high blood sugar levels from undiagnosed or poorly managed diabetes can affect the kidneys and bladder, making nighttime urination more frequent. Even conditions like sleep apnea, which disrupt oxygen flow during the night, can indirectly lead to increased urination as the body tries to compensate. Ignoring these signs doesn't just disrupt sleep. Over time, chronic sleep loss caused by nocturia can increase the risk of heart problems, depression, and weakened immunity. The constant interruption of rest takes a toll on the body's ability to repair, recharge, and regulate hormones. Some doctors also warn that broken sleep cycles in seniors are closely linked to falls, memory issues, and daytime fatigue, all of which chip away at a person's independence and quality of life. The truth is, frequent urination may be common, but it is not something to ignore or accept without question. Today, many treatments exist, from medications to behavioral therapies, that can ease these symptoms and restore rest. The first step is refusing to believe it's just old age. Your vitality depends on it. Low testosterone after 60 is often dismissed as an unavoidable part of aging, but urologists caution that this belief can be harmful. Testosterone plays a critical role in energy levels, muscle strength, cognitive clarity, and even emotional stability. When it drops too low, the result isn't just tiredness. It's a gradual erosion of vitality that can impact nearly every part of daily life. Some seniors report feeling mentally foggy, emotionally flat, or physically weak, but they're often told this is just getting older. That's not always true. Studies show that men over 60 can still maintain healthy testosterone levels with the right medical support. The body's production may slow down, but that doesn't mean there are no solutions. Urologists explain that low testosterone, also known as late-onset hypogonadism, is a recognized condition and can be diagnosed with a simple blood test. Once confirmed, treatment options are tailored based on a person's overall health, symptoms, and hormone levels. These treatments don't always mean injections or patches. They can include changes in medications, weight management, resistance, exercise, and sometimes the use of medically approved natural supplements. Some doctors recommend reviewing other underlying issues first, like sleep disorders or chronic stress, which can suppress testosterone. Others point to research indicating that even moderate lifestyle changes, when guided by professionals, can have a significant impact on restoring hormone balance. What's important is that seniors are not left believing there's nothing they can do. That mindset causes people to accept fatigue, loss of motivation, and physical decline as their new normal, when better outcomes are often within reach. Ignoring low testosterone can also contribute to more serious problems over time, including reduced bone density, increased risk of falls, and even cardiovascular complications. That's why urologists emphasize regular screenings and honest conversations. Believing that testosterone loss is untreatable after 60 isn't just outdated, it's a lie that steals strength, confidence, and quality of life. Reducing water intake to avoid frequent bathroom trips is a common piece of advice given to seniors, but urologists warn that this approach can be harmful. While it may seem logical to drink less to limit urination, doing so can lead to chronic dehydration, which negatively impacts nearly every system in the body. Seniors are especially vulnerable because the body's thirst response weakens with age, making it easier to become dehydrated without realizing it. When fluid levels drop, essential functions, from brain activity to kidney performance, begin to suffer quietly but significantly. Some doctors point out that dehydration is one of the most overlooked causes of fatigue, confusion, and even falls in older adults. When the body lacks water, blood becomes thicker, circulation slows, and the heart has to work harder to pump it. This increases the risk of cardiovascular strain and lowers overall energy levels. The brain also feels the effects. Research shows that even mild dehydration can impair memory, focus, and decision-making, making daily tasks more difficult and draining. Urologists emphasize that avoiding water to skip a few bathroom visits can quietly rob seniors of both mental clarity and physical strength. Hydration also plays a key role in regulating body temperature, supporting digestion, and maintaining healthy skin and joints. Without enough fluids, the bladder becomes more irritable and sensitive, potentially worsening urgency and frequency, the very symptoms some are trying to avoid. This can create a frustrating cycle where dehydration leads to bladder issues, and those issues lead to even more fluid restriction. The key, according to experts, is not to fear water, but to manage it wisely. Spreading fluid intake throughout the day, avoiding large amounts before bed, and limiting bladder irritants like caffeine or alcohol can all help. But cutting water entirely is never the answer. Urologists consistently advise seniors to stay hydrated in a way that supports their body without overwhelming it. The lie that less water equals more control is one that slowly chips away at vitality, clarity, and overall health. Erectile dysfunction is often explained away as a natural part of aging, but urologists warn that this belief can lead to missed warning signs of deeper health problems. While age may play a role, ED is frequently one of the earliest indicators of poor blood flow, high blood pressure, or undiagnosed cardiovascular disease. The blood vessels in the penis are smaller and more sensitive than those in other parts of the body, which means circulation problems tend to show up there first. Some doctors even describe ED as a canary in the coal mine for heart health. Studies have shown that men experiencing erectile dysfunction are more likely to develop heart conditions within the following 3 to 5 years. This connection is so strong that many cardiologists now recommend a full heart health evaluation for patients reporting new or worsening ED. Urologists emphasize that ignoring ED or brushing it off as an age-related issue delays opportunities for early diagnosis and treatment of potentially serious conditions like atherosclerosis or diabetes. Left unaddressed, the risk to overall health and longevity increases. Beyond the medical risks, untreated ED also affects emotional well-being and intimate relationships. Men who believe they are simply too old to expect change may stop seeking solutions, leading to unnecessary shame, isolation, and frustration. But there are a range of treatments, from medications to non-drug therapies, that are effective and safe even for older adults. Urologists stress that these options are most successful when the underlying causes are identified early. Erectile dysfunction is not just about aging, and treating it as such does a disservice to men's health. The body often sends quiet signals before more serious conditions arise, and ED is one of those signals. Recognizing it as a medical symptom rather than a natural decline opens the door to both better heart health and restored vitality. Urologists consistently encourage men over 50 to take ED seriously, not just for sexual health, but for the bigger picture of long-term wellness. Assuming all prostate problems mean cancer is a harmful misunderstanding that leads many seniors to delay care. Urologists emphasize that while the prostate can develop issues with age, the majority of these problems are not cancerous. Conditions like benign prostatic hyperplasia, BPH, which causes the prostate to enlarge, are extremely common and affect nearly half of men over 60. Although symptoms like frequent urination, a weak stream, or difficulty starting can feel alarming, they often stem from benign causes that are manageable with proper treatment. Avoiding checkups due to fear of a cancer diagnosis only increases discomfort and anxiety. Some doctors warn that waiting too long can lead to worsening symptoms, bladder damage, or unnecessary emotional stress. In contrast, early evaluation can provide reassurance, offer treatment options, and in many cases, confirm that the issue is not life-threatening. Even when prostate cancer is found, it is often slow-growing and treatable, especially when detected early. Many men live full, healthy lives with monitored or treated prostate cancer, which is why screenings are essential and should not be avoided out of fear. Prostate-specific antigen, PSA blood tests, and physical exams allow doctors to assess risk and monitor any changes over time. Urologists often explain that these tools are used not to alarm patients, but to guide decisions and catch issues before they become serious. Skipping screenings out of anxiety often leads to unnecessary suffering from problems that could have been easily managed or resolved. Believing that all prostate issues lead to cancer fuels silence, shame, and delay. It prevents men from getting the care they need and undermines the possibility of early intervention. Urologists urge older adults to separate fact from fear and take action based on knowledge, not myths. Regular checkups, clear conversations, and calm evaluations are the best path forward. Facing the truth early is far safer than waiting in fear. Blaming energy loss entirely on old age is one of the most misleading and harmful assumptions a senior can make. Urologists and aging specialists warn that while aging naturally brings some changes, ongoing fatigue is not something to accept blindly. Many older adults begin to feel slower or weaker and are told it's just part of growing older. But in reality, persistent low energy often points to fixable problems, not just the passage of time. One common cause is poor quality sleep. Seniors may struggle with staying asleep, experiencing conditions like sleep apnea or frequent nighttime urination, both of which interrupt the body's ability to recover. Without enough deep, uninterrupted rest, energy levels decline and the immune system weakens. Another factor is hormone imbalance. Testosterone and other hormones like thyroid and cortisol help regulate metabolism, mood, and stamina. When these levels drop below healthy ranges, as they often do after 50, they can leave a person feeling drained no matter how much rest they get. Urologists often recommend checking these levels through simple tests to rule out underlying endocrine issues. Nutrient deficiencies are also a hidden cause of fatigue. Low levels of vitamin D, B12, iron, or magnesium are surprisingly common in older adults, especially those with poor appetite, limited diets, or digestive issues that interfere with absorption. These deficiencies can mimic the symptoms of aging, including mental fog, weakness, and low motivation. Yet, they're usually easy to correct with targeted nutrition and supplements, once identified through proper testing. Some doctors warn that ignoring chronic fatigue can also delay the diagnosis of more serious illnesses like heart disease or diabetes, which often begin subtly. Accepting tiredness as a normal part of aging can blind seniors to early warning signs. Urologists stress the importance of speaking up about energy loss, asking questions, and seeking support. Seniors deserve to feel strong and vibrant, not just awake, but truly alive. Fatigue isn't something to ignore. It's something to investigate. Saying that supplements don't matter after 60 is a dangerous misconception that can quietly accelerate decline. Urologists and aging experts stress that certain nutrients become even more essential as the body ages, not less. After 60, absorption of key vitamins and minerals tends to weaken. The body becomes less efficient at pulling B12 from food, less responsive to sunlight for producing vitamin D, and more prone to deficiencies in zinc and magnesium, all of which play crucial roles in keeping the body stable and strong. Vitamin B12, for instance, is critical for nerve health and cognitive clarity. Without enough of it, seniors may begin to experience memory problems, tingling sensations, and overall fatigue. Some studies have even linked low B12 levels to balance issues and increased risk of falls. Yet because symptoms build slowly, many people don't realize the cause until significant harm has occurred. Similarly, vitamin D is necessary for bone strength, immune response, and muscle function. Low levels are extremely common in older adults and often go undetected until a fracture or infection appears. Some doctors warn that chronically low vitamin D can also contribute to bladder control issues by weakening pelvic muscles. Zinc supports the immune system, wound healing, and hormone balance, particularly testosterone, which influences energy, mood, and sexual function. Magnesium helps regulate sleep, blood pressure, and nerve signals. When magnesium runs low, people often experience cramps, anxiety, or restless sleep, yet overlook it as a nutritional cause. Urologists highlight that many of these symptoms are incorrectly labeled as just aging, when in fact they may be signs of a body running on empty. Ignoring supplements because of age means missing a critical support system. These nutrients act like behind-the-scenes workers, keeping systems regulated and strong. Skipping them doesn't just stop progress, it sets the stage for slow, silent decline. Urologists urge seniors to think of targeted supplements not as luxury, but as maintenance, the kind that preserves strength, steadiness, and independence far longer than guesswork or neglect ever could. Believing that pelvic floor exercises are only for women causes many men to miss out on a powerful tool for maintaining strength and control as they age. Urologists stress that men also have pelvic floor muscles, a group of muscles that support the bladder, bowel, and sexual function. When these muscles weaken, the results can be both frustrating and life-altering. Common signs include urinary leakage, especially when coughing or sneezing, difficulty fully emptying the bladder, and reduced sexual performance or sensation. Yet, because pelvic health is rarely discussed with men, many suffer in silence or assume these changes are just part of aging. Some doctors point out that weak pelvic muscles can also lead to poor posture and core instability, which affects balance and increases the risk of falls. The pelvic floor connects to the abdominal and lower back muscles, forming part of the body's foundational support system. When this area loses tone, it can lead to discomfort, digestive issues, and a general sense of weakness that chips away at confidence and independence. For men over 50, especially those who have had prostate surgery or struggle with chronic coughing, obesity, or constipation, the pelvic floor is often already under extra strain. Urologists recommend a specific form of exercise known as Kegels for men to strengthen these muscles. These involve gently contracting the same muscles used to stop the flow of urine, holding for a few seconds, and repeating throughout the day. When done consistently, pelvic floor exercises can improve bladder control, enhance sexual health, and even reduce the need for medication or invasive procedures. Some research also shows that men who practice these exercises regularly report better overall confidence and comfort in daily life. Ignoring pelvic floor health simply because it's been labeled a women's issue leaves men vulnerable to preventable decline. Urologists urge men to take control by learning these simple movements and making them part of a daily routine. The benefits are quiet but profound. More control, more stability, and more dignity with age. Assuming that a health issue isn't serious simply because it doesn't cause pain is a dangerous mindset, especially when it comes to urologic health. Many seniors delay important checkups or ignore subtle changes because they feel no discomfort. But urologists warn that some of the most serious conditions, including prostate enlargement, kidney dysfunction, and early-stage bladder cancer, often develop quietly, without pain or obvious warning signs. By the time symptoms appear, damage may already be underway. Prostate enlargement, also known as benign prostatic hyperplasia, often begins with small changes like increased nighttime urination or a slower stream. These signs may seem harmless or easy to dismiss, but if left unchecked, they can lead to bladder strain, infections, or even long-term kidney problems. Some men adjust their lives around these symptoms without ever realizing the growing pressure on their system. The absence of pain makes the problem feel less urgent, but the body may be silently struggling. Kidney dysfunction is another condition that often progresses without pain. The kidneys can lose significant function before any clear symptoms arise. Some doctors emphasize that by the time swelling, fatigue, or blood pressure issues appear, kidney health may already be compromised. Regular testing, including simple blood work and urine analysis, can detect these problems early, while they're still manageable. Waiting for pain to serve as a warning often means waiting too long. Bladder cancer, especially in its early stages, can also be painless. It might show up only through subtle signs like blood in the urine, which may not even be visible. Because there's no discomfort, many people assume nothing is wrong. This delay in diagnosis reduces treatment options and worsens outcomes. Urologists consistently remind patients that pain is not the only measure of health, and in many cases, it's a late one. Ignoring problems just because they don't hurt leads to preventable decline. Silent conditions can rob seniors of years of strength, clarity, and independence. The best protection comes from awareness and routine screenings, not from waiting for pain to speak. Acting early, even when things feel fine, is how vitality is preserved. Believing that surgery is the only option for urinary problems leads many seniors to avoid medical care altogether, choosing silent suffering over feared procedures. Urologists strongly emphasize that this belief is outdated. In reality, many urinary symptoms, including urgency, leakage, hesitancy, or weak stream, can now be addressed with non-invasive treatments, therapy, and lifestyle changes that do not involve surgery at all. Advances in medical science have expanded the range of options available, allowing seniors to improve bladder control, reduce discomfort, and restore confidence without going under the knife. Pelvic floor therapy is one of the most effective and overlooked alternatives. These targeted exercises strengthen the muscles that support the bladder and urethra, helping to improve control and reduce leaks. For men and women alike, especially after childbirth, prostate surgery, or years of chronic pressure, pelvic floor weakness plays a key role in symptoms, and it's highly treatable through guided physical therapy. Urologists often refer patients to pelvic specialists before even considering surgical intervention because the results can be so powerful. In addition to therapy, new medications and bladder training techniques allow for symptom management without invasive procedures. For overactive bladder, timed voiding and certain medications can calm the bladder muscles and improve urgency. Some treatments also focus on adjusting nerve signals that affect bladder control. These are often outpatient solutions that do not require cutting, stitches, or hospital stays. Some doctors also recommend reviewing medications, as certain blood pressure or heart drugs can worsen urinary issues. A small adjustment can sometimes relieve major symptoms. Even dietary changes can help. Reducing bladder irritants like caffeine or artificial sweeteners, increasing water intake at the right times, and addressing constipation can all make a difference. These simple interventions are often enough to improve quality of life when guided by a trained specialist. Holding back from care due to fear of surgery is not only unnecessary, it prolongs suffering. Urologists want seniors to know that surgery is rarely the first option and often not needed at all. With modern tools, knowledge, and supportive care, relief is closer than it seems, and far gentler than many assume.